Hello, my name is Nicole Lee and I'm a student at Indiana State's Doctor of Athletic Training program. Today I'm going to be discussing patient education and healthcare literacy. So what is healthcare literacy and really what does it mean? So it is the degree to which individuals have the capacity to obtain, process, and understand basic healthcare information and services needed to make appropriate health decisions. So I want you to kind of just think for a second about the last patient you encountered and maybe think about what their healthcare literacy was, and we'll go ahead and kind of break that up and look at averages. So again, what does this all mean? So adequate health literacy. So if somebody has an adequate health literacy, they're able to read and comprehend essential health-related materials. They might be able to understand prescription bottles without you having to explain it to them, or they can understand information on their appointment slips and etc. But it's important to know that over 33% of U.S. adults have low health literacy, so they're not able to understand prescription labels or understand education handouts. And most adults over the age of 65 or older have low health literacy. This is really important to know when you're working with different populations. I know in athletic training we don't mostly work with anyone over 65, but if we are considered healthcare providers, we need to know this information. So patients who have low health literacy have they're more likely to visit an emergency room or have longer or more hospital stays, are less likely to follow treatment plans, and have higher mortality rates. The reason this is they don't really understand if maybe things are getting worse, when they need to seek medical attention, and sometimes this might be when it's too late, and that might result in them having longer hospital stays or even death. And then if we look at the social determinants of health, I'll go ahead and break these down shortly. We're going to look at economic stability, education, health and health care, neighborhood and built environment, and social and community context. So within that, you're going to see, let's look at economic stability. So we might look at employment, income, expenses, debt, medical bills, and support. Neighborhood, their housing, the transportation, the safety of the community. If a patient does not feel safe in their community and they don't have a car, they might not get on a bus, or they might not take rides there because they don't want to be outside, things like that, or the walkability. If we look at education, we're going to look at literacy, their language. Did they get their GED? Are they a high school diploma? Do they have some college? Do they have bachelor's, or do they have post-professional education? And if we look at food, their access to healthy options. That doesn't affect us too much, but it's still important to know. And then community and social context. What's their support system look like? What's the community engagement within their area? Is there any discrimination? And then healthcare system is the quality of care and provider availability and the health coverage. So these are all really important because they all lead to the health outcome, which is going to be mortality, morbidity, life expectancy, healthcare expenditures, health status, and functional limitations. And then, so when we're integrating social care into the delivery of healthcare, we need to remember 5 things, and the 5 A's. We have awareness, adjustment, assistance, alignment, and advocacy. So with that, I'm going to give you an example. So when we look at transportation, so awareness. We need to straight up ask the individuals or our patients about their access to transportation. If even right now they do have transportation, but they know they're going to be having surgery, what does that look like to them? Are they going to ask are they going to ask their friends, their family, what's their social system, things like that? Adjustment. And well, if we know that they're going to have a decreased access to transportation, then we need to adjust. We need to reduce the need for in-person healthcare appointments, and use things such as telehealth appointments or telemedicine. Assistance. So we need to provide transportation vouchers so that patients can travel to healthcare appointments. I believe that Medicare might be kind of coming along with this, where they are trying to, within the payments for Medicare, it allows them to have 1 or 2 visits or 1 or 2 vouchers per month for like Uber, things like that, so that these patients can get to their appointments. Alignment is obviously investing in community ride sharing, which we kind of just discussed, and then advocating. So work to promote these policies within your the foundation that you work with, and bring the importance that transportation is very important for your community and for your patients. And when we look at patient education tools, we need to use, simplify complex words. Instead of using physician, use the word doctor. So physicians, that gets kind of confusing for patients, so doctor is very to the point. And if you want the patient to contact somebody, describe what contact means. I mean, call, text, email, things like that, because sometimes that might get confusing. So make sure you're very adamant about how you want them to contact the providers. And then obviously bolding or italicizing keywords, using bullets to help the reader follow information. And then, educate the patient and make sure they understand what it means for them and how they can better their health. So that means interactive elements. So use fill in the blanks as you're going over patient information. Have them fill it in so that they understand and they can tell you and show you what the words that they're using. And then last, just a summary. So if we design healthcare delivery to integrate social care into healthcare and understand health literacy of your patients, so understanding that awareness about potential root causes of ill health, which kind of goes back to the social determinants, and the importance of addressing them in and with the communities, it will contribute to more effective strategies for improving health and healthcare for underserved individuals, communities, and populations.